Clinical commissioning groups are the bodies that from the 1st of April 2013 will be responsible for, in effect, commissioning healthcare for the population. And when I talk about commissioning healthcare, that's planning healthcare services and also buying services. And those services will be bought from acute hospitals. They'll buy community services and services from people like the voluntary sector and others. So taxpayers' money is going to be spent by clinical commissioning groups on behalf of those taxpayers. Our total budget across both Stafford and surrounds and Cannock Chase CCGs is 304 million for the next 12 months. And for example, that will buy services at Midstaff's Hospital Trust. So it buys acute hospital beds, it buys elective surgery, people going for operations, for hip operations, that's the sort of thing it buys. And it also buys community services. So for example, it buys district nursing services, health visiting. Well, Conversation Staffordshire is what anybody wants to make it, really. It's simply put, it's about how do we engage with 276,000 people across Stafford and surrounds and Cannock Chase CCGs in a conversation about what they want from health services in their areas. Because I think clinical commissioning groups have got to be different. The previous organisations spent their time trying to engage with communities, but I think were pretty unsuccessful, and I was part of that. And we have to try something different. The relationship now has to be different, so the community has an equal relationship with the CCG in deciding how money is best spent for their benefit. People can join the conversation in different ways. We're trying something different. We've got a couple of days where we've got people together to have a conversation about healthcare, but we're also trying to use multimedia in that we're going to have conversations going on in other venues where we won't be there. We'll be there virtually, but we'll get people to talk about what they want from health services. And it's the start of a conversation. We've got our websites where we've got information going into general practitioners, GP practices, and we're wanting to gather information from anywhere, really. And it's about creating an environment where people know they can talk to this organisation called a clinical commissioning group that's made up of real people who've got real interest in healthcare and real interest in doing something better for the populations that they serve. Well, basically, they get it online by using Facebook and Twitter and continuing that conversation throughout the months and years. Because if we're really good at this, we will continually get a stream of information back about services, about what people are interested in, what people think we should be doing. And of course, the challenge then is being able to have the conversation with people about what we can and what we can't do. Because we're not going to be able to do everything for people. But again, it's about a bit of honesty that says, this is the sorts of things we can do, this is the sorts of things we can't do at the moment. But if, for example, we did something different, perhaps we could do. Well, my rallying call is I want a conversation as an individual with 276,000 people. Therefore, I want everybody involved because actually it makes us relevant. If we don't have that conversation, we don't listen to our communities, we become irrelevant to the process of commissioning healthcare for the population because there is a disconnect between the two, and we can't afford that. It's as much about a listening exercise as a talking exercise. What we really want to try and do, though, is get a debate going about what's important for local people, because if we get levels of importance, we can then do some work around prioritising those things and actually make sure that we are responding to what local people want rather than just sitting in a building thinking, well, what do we think they want? We're actually getting at real people. This is about how do you get to real people who potentially don't necessarily engage in the debate about healthcare because they are so busy running their own lives. This is hopefully an easy way of them getting involved.
We want people to be involved in a number of ways with Healthwatch Staffordshire. They can be members, merely receive information and provide us with some feedback. They can take a more active role, the role of Healthwatch champions, which we will be looking to establish in all areas across the county to organise local groups, to support those groups and to run events on behalf of Healthwatch, but also encourage feedback from other participating organisations. Healthwatch champions are vital because they will be the lead for larger and smaller communities throughout the county, whether it be from interest groups, organisations, and they will be the focus and the conduit to feedback to us what the views and concerns of folk are. I think there's a number of things I can get out of it. Firstly, it's to understand that their views will be received and taken on board and acted upon. They can support their local communities. They can support other organisations within the community. And I think they can also get a lot of personal satisfaction. Enter in view is where we have the legal right to go into premises that deliver health and social care services, those that are publicly funded. We can look at a hospital ward, for instance, or a care home, or even an ambulance service. And it is for us to go observe and comment upon the quality of the services provided. They would receive a full training package before going on to any visits, and they would have ongoing training as well. We work with the Care Quality Commission and use their standards to identify issues that we may observe during a visit. It's to share their own experiences, but also to have a say in how services can be developed and, more importantly, delivered. Anybody. Anyone who has an interest. We're looking for representation from all age groups, from all sectors of the community. Absolutely. Unless we have a large number of people who support the work that we do, we can't possibly hope to succeed. We need to understand the concerns and reasons that people are perhaps dissatisfied with services, but we don't want to make decisions for them. We want them to tell us what their issues are. I think the strength of any community is how it treats all members of that community. And there's an opportunity for the people of Staffordshire to really get involved, have a say, and make a difference. And we want people to feel comfortable, whether they be representing an organisation, a smaller community, an interest group, whatever it happens to be. Everyone's opinion is important to us, and we need to get as many as we can.
Healthwatch Staffordshire is an organisation that's here to listen to the voice of patients and the public about health and social care services in Staffordshire, how they are delivered, what people's experiences of them are. Perhaps here in Staffordshire more than anywhere else, we know the importance of listening to people. We know what happened at Mid Staffordshire hospitals a few years ago. We know that people were complaining, were raising concerns, that those concerns weren't listened to sufficiently. And perhaps if they had been, those problems would have been sorted a lot earlier. We need to learn from that experience, and we need to make sure now that people have a powerful voice. For the first time, we have a statutory place on the Health and Wellbeing Board for Staffordshire. That's the board that has the great and the good who really organise services in Staffordshire, and we have an equal voice on that board. We can raise concerns there. We also have a national organisation, again for the first time, called Health Watch England. We have to report annually to that organisation, but we have dealings with them all the time. And if we're not happy with what's happening locally and we're not able to get anywhere locally, we've got that national body that we can go to. I think all of us should get engaged with Health Watch Staffordshire. All of us, in one way or another, experience health and social care services either for ourselves or through our relatives. And I think, therefore, it's so important for all of us that those services are right and are delivered in the right way, in the best way possible. So I think it's for everybody to get involved. No, I don't think so. I think it's really important that we hear about the good experiences people have had as well, because we can learn as much from those as we can from the complaints. And the other thing I think we can learn from is people's observations. Sometimes, by being a patient, you can see things in ways that professionals don't see, and you can have a really good opinion about how services can be improved. And I think we want to hear from those people as well. This is an absolutely key part of Health Watch Staffordshire. We've got a strong evidence and insight team who can actually look at what's coming forward, analyse it and spot trends, patterns, anomalies and raise those. But also it's very important to recognise we're a very small team. What we really need is our army of volunteers to get stuck in and to help with that voice and getting that voice across. I think anybody and everybody should get involved and should volunteer, and they can do it in lots of different ways. It could be just on a one-off basis, but actually we also have the role of Health Watch champions, people who can be the eyes and ears of the public on the ground and feed things through to us from across the county. We are actually visiting health providers and commissioners all the time. We're speaking with chief executives, we're speaking with the doctors, we're speaking with the people who run services in Staffordshire. We understand how those services are run, and we're able at those highest levels to feed in people's views. I think it's absolutely crucial that Health Watch providers and commissioners get behind Health Watch Staffordshire. They are the people running services, but they need to listen to the public. We know how important the patient voice is. We know how important the service user voice is, and we know that we can influence the improvements that are needed in services at a time when there are some tough decisions to be made about health and social care in the county. We know money is not infinite, and we know that we really need to hear from patients about what's most important. I think we really need to build those genuine relationships with healthcare providers and commissioners. They've got some tough decisions and some tough calls to make, and I think we need to work with them, help them to understand what's most important to people, what's going to work best here in this county, in Staffordshire, and help to support them as they take forward those difficult decisions. Well, we've got a number of ways in which we can help service providers. For one local group of doctors, for instance, we've recently been doing a survey about A&E services and finding out why people go to A&E, what alternatives there might be and why people aren't using those alternatives. And we're feeding that back to that group of doctors, and they're finding that extremely helpful in how they shape services for the future. We can also help people with consultations when they are looking at changing the way services are delivered. We can help them to understand what's really important to the public. In particular, at Health Watch Staffordshire, we really think it's important that we feed back to the public who've raised issues with us what's happened to those issues. So, for instance, we've recently had a big public appeal to listen to patients' experiences of Stafford Hospital. we will feed that back in a report. We will make sure that everybody that's rung us who wants a copy of that report gets a copy of that report, and we will also tell them what the hospital have done as a result of our report. And that's the hallmark of how we want to set about our business. Every time anybody goes into a provider premises and does an interim view visit, we'll make sure that they get a report based on that visit, and we'll make sure that everything is published on our website so that people can really see what's happened when they've raised issues with us. There are health watches in every part of the country, in every local area in England, but in Staffordshire we like to believe that we've got a Rolls-Royce of a health watch. In particular, we've developed the service that allows us to really understand what people are saying, to be able to trace patterns, trends, to raise those with commissioners, with providers, and to make sure that people's voices are heard. And we think that in Staffordshire we've got a model that the rest of the country can follow. Conversation Staffordshire is a great concept. It's a chance for everybody to get involved. It's a chance for people to get involved in a variety of different ways. We've got lots of different social media ways of getting involved, such as Twitter and Facebook, but also we've got events and we've got drop-in centres. And it's a chance for people to really have their say in how the decisions of the future of health and social care are made in Staffordshire. We are very pleased at Engaging Community Staffordshire to be backing Conversation Staffordshire.